According to the CDC, atrial fibrillation, or AFib, is the most common type of heart rhythm disorder. As many as 6 million people in the United States have AFib, and with the aging population, this number is expected to increase. Dr. Ramanna Merla, a cardiologist at Pomona Valley Hospital Medical Center, discusses the range of symptoms and risk factors for AFib.
Atrial fibrillation is an abnormal rhythm of the heart. In layman term, the way to describe it is the heart is beating like a bag of worms instead of going in a very regular fashion. AFib symptoms are highly variable. There is one extreme where patients have no symptoms at all. They just come with the EKG and it's very easy to treat them. The other extreme is they have fatigue, they have shortness of breath, they have swelling in the legs, they sometimes have palpitations or racing heartbeat. These are the symptoms of atrial fibrillation. The prevention is, one is we want them to lose weight, which is the most common risk factor. Treat sleep apnea. We rule out any other causes that can cause like thyroid, or if there's abnormal valve problems of the heart, we treat those first. It starts at the age of 45 and keeps increasing with age, which is a major risk factor. And by the time you're 80, 90, a big portion of the population has atrial fibrillation.
Dr. Merla reveals diagnosis and treatment options for AFib.
Atrial fibrillation is diagnosed with an EKG. The EKG, we can see the irregular rhythm, and that's the main diagnosis. So the treatment options for atrial fibrillation is divided into two. One is something called the rate control. The other one is the rhythm control. The rate control is what we do for majority of the patients, where we leave them in atrial fibrillation. We don't try to correct the rhythm. We just prevent them from going fast by giving medication to slow the heart. And there's the other group where the rhythm control is when they fail this rate control, then we go to rhythm control. And the rhythm control can again be divided into two parts. The first one is giving them something called antiarrhythmic medications to put them back into normal rhythm and try to keep them in normal rhythm. And if still they don't respond to this, or they don't want to be on antiarrhythmic medications for life, then we go to something called ablation. It's not a big surgery. We take catheters from the groin, from the femoral veins. We thread them up towards the heart, and we burn around the pulmonary veins. So we can either use heat, which we call radiofrequency ablation, or we can use cold, which we call cryoablation, to separate the veins from the atrium itself. The success rate is around 70%, and we may have to go back the second time to get up to 90%.
Dr. Merla gives us a patient's story.
I had a patient, a young ice hockey player. He was having a lot of this palpitation, shortness of breath, and in his case, even his heart function was low because of the atrial fibrillation. But with one ablation, he has not had any recurrence. It's been 2 years. He's back playing ice hockey, and he's even, because he's young, he's come off even all the blood thinners, and he's doing very well.